Up next on DiCHiPi Unfiltered.
So basic etiquette is just get tested for HIV if you are in a sexual relationship with someone.
Correct?
But my next serious crush was when I was 16.
Hey, when you
Just 3
crushes
years.
every 3 years.
Just 3 years,
Bro,
we're like,
that's
I'm
nice.
ready. Yeah, but that crush ended up to be my husband.
Ooh, love
it.
I love that.
Love it.
Why would the boy sex? My dear.
Hey, guys, it likes me.
God,
no.
Yo. DiCHiPi Salva, welcome to episode 12 of DiCHiPi Unfiltered, a show that really is unpacking what happened on DiCHiPi, SABC1's most fabulous show, in my humble opinion. It's about 4 girls who walk around the streets of Soshanguve, navigating their sexual health, their mental health, their financial pocket, wallet health. My name is Barbara Mwachi, and I'm going to be your host today. But I'm not alone. I'm with Nthabi saying one of the main characters of the show, whose most favorite topic to talk about is sex.
Yes.
Allegedly.
Hey.
Why would the boy sex?
Hey,
My dear.
hey, guys, it likes me.
God
Yo.
I hope your mom's out there watching this video right
Gadala.
now. But
Anyway.
I think it's a great thing that we've got Nthabi saying,
Yeah.
who kind of represents this taboo part of every single one of us. I think human beings were made with that function of being able to
Yeah.
reproduce. Otherwise, you and I would not be sitting here
Exactly.
today. So the fact that we've got a character like you who's so bold in her expression and figuring things out gives us a platform to kind of chat it out and figure things out and learn.
Oh, please. Plus, I like that about Nthabi Sen because you get to explore these type of topics,
Yes.
of which they're very important. As you said, we wouldn't be here
Yes.
if it wasn't for that.
Exactly. I just want to say to all the parents who might be looking in the comment section and listening to this podcast episode, please, it's not us. It's Nthabi saying. All the comments they're asking, they're not asking for themselves. They're asking for Nthabi saying. Tina, when we're asking questions, we are not asking for ourselves. We are asking for Nthabi saying.
Hey,
And Nthabi
Maka.
saying has just broken up. Nthabi saying has just broken up with Tay. Can you tell us a bit about like that entire situation?
You're saying, Nthabi Sen thought she was in her Cinderella moment.
Isha,
Cinderella
boy.
era. She found her Prince Charming.
Was six-pack.
Was six-pack. And right now, a betrayer.
Ah.
So after that betrayal, Nthabi Sen got to see her age. Actually, there are other things outside stay.
Yes.
You get what I'm saying? So, yeah, no. Go everything is just
Go west.
go west. And I feel like she's beyond the go west. Now she's
Yes.
talking to herself.
Yeah, and I
get what
like
I'm
that.
saying?
I like that she's come to a point in her journey where in the beginning we saw her being quite unsure, like she's asking Bume for help, she's asking herself questions, she's going back and forth, having dreams, nightmares, a whole lot of things. And then she gets to a point where she's actually like, you know what? This is my life, this is my sexual
Yes.
health, and this is how I want it to play out. Which is really
Exactly.
cool. I think a lot of us could learn from Nthabi saying in that instance. But Grace is somebody who doesn't have the same power as Nthabi saying.
Eish, my girl Grace.
Chumya how?
One stress.
Your friend.
Azanka obana Nthabi saying ne one stress herself, but Grace on stress more. Because at least with Nthabi saying she gets to explore that, she gets to see her.
You see the transition, the journey.
One like, yo, ish,
Grace Enogara, she runs in the opposite direction.
bro. She does, honestly. And with Prince Charming Wahaye in the picture, she didn't really want to explore that whole atmosphere.
Yes.
But I mean, you get to go on your own journey.
Yes.
With your own pace. So we are not really comparing. So yeah.
And I think it's important that you said that. Like, it's a journey at the end of the day. And the
Exactly.
pace is your own. So even Mpume is somebody who we see sexual journey is far more advanced than Nthabi saying.
Yeah.
But at least Nthabi saying is trying. And then you get Grace, whose journey is just, she doesn't want to acknowledge that there is
She'll
a journey
get there.
to be walking on. And I think
Yeah.
that's one important thing that we really need to look at when we're dealing with this conversation on sexual health, on the clinic, on, crushes, young
Hey.
people, is that it's yours. and you decide the pace. Don't let a relationship, don't let the next person dictate to you how fast you should be going, whether you should be having sex or not, and how that sex should look like. I don't know if you have anything that stands out for you in terms of the conversations we've had up until now about sex with all the different peoples.
What stands out for me is Nthabi saying going to the clinic now for herself, not for stay. Is that what stands out for me, honestly? Because having that courage, or actually, I want to know more. What is going on with myself?
Yes.
What is that stands out for me, because it brings empowerment with it. You get what I'm saying?
And in terms of the sexual health, let me do that again. And in terms of the sexual health experts that we've had on the show, on the podcast, is there anything that has been shared that kind of stood out for you?
Yeah. All the information about the different kinds of contraceptives.
Oh, yes! There was that one episode where we were told about the female condom and how, like, it isn't necessarily just something that's used for females, but can also be used in same-sex relationships.
I know, right?
That was wild.
I didn't know that.
I had no idea. And she said, okay, cool. I think you and I can go on and on about the things that shock us and that we don't know. But there's so many questions that personally I feel like need to be answered, that I know someone who is like me is out there thinking to themselves, I'm not brave enough to ask these questions with my chest. So what you and I are going to do is take on Izinkinga Zemhlaba. I hope I'm saying that right. Zulu people, please crown me as your Zulu princess. If I say it right, I'm going to be a Zulu princess. That's going to be my destiny.
Yeah.
But I want us to take people's kind of questions, dramas, put yourself in the shoes of someone like Nthabi saying a Grace and Mpume, and let's bring in an expert who can help us answer these questions once and for all. It's episode 12. We're almost at the finish line. I think we need answers.
We do, because Ragoisha.
Yeah.
Have you seen the breakup and Nthabi saying?
Esha, boy.
Yeah, young hair deeply inside. Young hair, I can't. It's my
I
girl.
want to release
It's my girl.
Okay, I think
And we
next
can-
episode we need to bring someone to come and help you deal with that hurt. Ne?
And we can also see the moment where Nthabi saying friends was trying to console her. So
Oh, yes, and after looking at Nthabi Singh's little situation, we are going to be speaking to our expert.
Okay, guys, what about ticket sales? How's it looking?
Bookings are popping off, especially online. Guys, people really like things, hey?
Oh, Mensa, I'm gonna have to go to the station, hey? I need to check in.
Check in. Wait, bogan to school, pila 1990.
Hi, Buena.
How? Sabi saying, awubona ukuthi mhlawumbe ungasebenzisa lesikhathi ukuthi upractice yabo i-set yakho i-comment ozoyenza. Sabi saying, to Sabi saying, kwenzakalani? Oh,
Eish, ke tabele ya sithe. Nna ke mo hopotse.
kanti awusho ngo-10 hlukene nalo mfana.
Mara o itse sorry. Rodasang was in his bedroom and had access to his phone.
Yabona nje mina, lo mfana lo ufuna nje ukukhipha ugangster bakho phakathi. Khathi mlusi, ngeke.
Exactly. You should focus on your stand-up and get the stay guy. He doesn't know right from wrong.
Amechomi, wena unahanang.
Hayi, mngani, mina ngithi nje step back kuyona yonke nje lento nosithe. You don't need to put yourself under unnecessary pressure. Na. Nanokuthi nje you must make things clear so that he knows where you stand.
When you're right, you're right.
Exactly. Tshele wena Grace. Ho. Buka la, So, do you think we're still good, please? Aren't you Grace?
What are you still doing here?
I forgot my toolbox.
That would be bad. Please say thank you to your dad and thank you to you for everything. You guys have been like really flexible and I appreciate it.
Okay, the center, it means a lot to the community. Can I ask you something?
Yeah, sure.
Date your boyfriend?
Uko?
Because I think you're super sexy.
What? I have to go somewhere. That's not here. Okay, thanks. Bye.
Your tool bag box. Sorry.
Yeah.
This is right there.
All right, so we've had a lot to see, but you haven't seen the best part. We've got in the building with us a public health professional who studied in Berlin, University of Pretoria, Gibbs Institute of Business, what with an MBA. And it doesn't just end there, because she's also got a degree as a doctor, as a medical professional. And what you'll see about this particular guest is that she's got the aura of Michelle Obama, but it's not because she's a president. It's because she's the country director of South Africa's Girl Effect leg. Dr. Lisa, welcome to the podcast.
Thank you. What a wonderful introduction.
She said, what a wonderful introduction. I love how you're like batting your eyelashes, like, I'm just a lady here to talk about fancy things.
I'm just a woman, a mother.
Oh, I'm just a mother. That's a new one. I know all the moms are going to be taking a hashtag, I'm just a mother. I'm just a mother. But I'm so excited to have you here, because obviously you're the country director at Girl Effect, and everything we've been talking about in terms of JiK'iZiNTO stems from this company. Can you tell us about Girl Effect as an organization and what it does?
Sure. So Girl Effect is an international NGO. However, we have a locally registered entity, which is Girl Effect South Africa. It has been operating for many years, I think as far back as 2013, 2014, internationally. We have a lot of global presence around Africa specifically. So we're not only in South Africa, we're in Kenya, we're in Tanzania, we're in Nigeria, we're in Ethiopia, but outside of Africa, we're also in India. So that's where our geographic footprint. In South Africa, we focus specifically on improving lives of young people in South Africa. Girl Effect, generally, even globally, have a preference. Girl Effect, globally, also have this preference to focus on adolescent young women. What we believe is that if you empower a young woman, give her all the resources that she needs, she will flourish, and eventually she will be able to look after the community. So that for us is the Girl Effect.
That is too good. Can we get a hands there? She's so mesmerized. She's like, wow.
I'm
what are
there,
your thoughts?
like,
wow, what a woman.
Oh.
What a lady.
Michelle Obama.
Michelle Obama. I told
Oh.
you, she has the aura of a president.
Bro,
Like, when she walks in the room, it's like,
exactly.
that's why I wore blazer today. Because I was like, yeah, no, today
Hey,
we are
and you
talking
didn't
to
tell
the
me.
big dogs, Baba.
You didn't
MBA.
tell me. Yeah? It's like
But
we spoke to each other.
I think for me, I'm like, your story is one of the craziest things I've ever read, because how does a girl from Zambia then decide that I'm going to end up studying in Berlin, I'm going to get a medical degree, but I'm also going to get an MBA? Those are two very difficult things to accomplish. Besides your entire career and everything you've built, where did you get the audacity to dream that big?
Well, where do I start? I finished my O-levels, and I was bored at home, wondering what to do.
She said, I was bored at home.
So I pick up a newspaper, and there was this advert for a scholarship to study medicine in Berlin. And I applied, and lo and behold, out of about 250 applicants, I was one of the top 5, and that's how I found myself in Berlin, studying medicine. I left
Top
at the
5.
Exactly.
Bro, top 5.
So I left at the age of 18. I come from a family of 5 girls, and my dad was very happy. He says, "You've gotten this scholarship. Amazing, one less child to pay for, you're on your way." So that's
Those are fathers are. All fathers are like that. One less child to worry about. I know that's a big thing for you as well, because you've been studying and you're just like, yo, do I do the honors? Do I not do the honors?
Yo, yeah, no, I've been there. I'm still there. I'm like, yo, do I? No, let me leave it. No, let me go for it. No. Yeah, no.
It's a lot.
It's a
But
lot.
can I ask, so you obviously then have siblings, right? And were you the first in your family to study overseas, or had you seen that in your older sisters? Are you the eldest sister?
No, I'm the middle child.
Ooh.
So I've got 2 older sisters and 2 younger sisters. We were privileged to be born of a father who was a diplomat. So we traveled around the world and went to high school in the UK. So going abroad wasn't something that was new at the time. I wasn't the first doctor in the family either. I've got an older cousin
The pressure.
who went ahead of me, and he's a plastic surgeon. So you can imagine the pressure.
Yes.
But that being said, I was the first one to get a scholarship to study in the family and ended up in Berlin. So having that experience is extraordinary. I don't even know where to start telling you that story. But indeed, it shaped the person I am today.
And this is why you're the country director of Girl Effect South Africa. Because I think you not only work towards the mission, but you've lived the mission. You've seen the power of the mission. And that's probably why you're here today, Miss Ma'am. But we've got Miss Nthabi saying here on the couch, she plays Nthabi saying in the show, but in real life, she's Nkateko. Nkateko's a sweet girl. She's not boy obsessed, right, Nkateko?
No.
No, not at all. Not
Never.
at all. But her
Never.
character goes through the most tragicest, is tragicest even a word?
Let's make it a word.
Let's make it a word, right? And I think just hearing your story, it makes sense why you are the country director of Girl Effect South Africa, because it's not just a mission that you work towards, but it's a mission that you've lived yourself. And your story is a testament to the power of a girl child and the power, or the effect rather, of having a girl that is empowered. How does JiK'iZiNTO come into play in the whole ecosystem of Girl Effect?
Sure, thanks for that question. I'll answer it in two ways. I'll answer it JiK'iZiNTO the program and JiK'iZiNTO the brand.
Okay.
So JiK'iZiNTO the program is really focused on three thematic areas. We have mental well-being, sexual reproductive health and rights, and economic empowerment. So all of those are three thematic areas that are important to a young woman trying to make it through life. So as a program, we try to reach that young woman, make sure we give her all the information that she needs, give her the resources that she needs, and guide her to accessing services that she needs to make those differences in her life. So the program really focuses on that, and we have targets and all of those things that usually, public health programs usually have. But I want to focus a bit about JiK'iZiNTO, the brand, because this is a brand I think I believe in and all of us at Girl Effect believes in. It's a brand that's vibrant. It speaks to the young woman, and not limiting just to young women, also to the young person, a male, as well as other social actors in society. It's very vibrant. It speaks in the language that young people understand. It really portrays role models as well within the society that young people want to aspire to become. So I think that JiK'iZiNTO is aspirational. JiK'iZiNTO is understanding. JiK'iZiNTO is non-judgmental. JiK'iZiNTO is a brand that allows a young person to be.
I mean, Barbara, didn't she just describe DiCHiPi?
She did, actually.
She did.
Actually, I was thinking about that. I'm thinking of all the different characters and how they
Exactly.
can be role models in their different areas, but also people that we can learn from. I think the cool thing about DiCHiPi, the show, is that it's not a show that you just watch casually and it's like, oh, okay, great. But it's like, I actually learned a few things from there. I didn't know that if you take contraceptives, like an oral contraceptive, you're not protected from STIs. It sounds like common sense, right? But when I was watching the show, I was like, oh, snap. Like, I never thought of it like that.
Yeah, of course. It's the show was meant to be that way. DiCHiPi by JiK'iZiNTO was meant to ensure that, a young person understands, who's asking the same question as you are, gets an answer, an accurate answer to that question. So the issue here in this particular episode is around contraception and how do I access that. And we all know there's all types of contraception, right?
100 million.
It all depends on your preference, your lifestyle, what your discipline even. You spoke about the pill. The pill, to take the pill, you
for
need
a
to be
serious
very
girl.
serious and disciplined.
Yes.
Because you take it every day at the same time of the day. So you can't take it in the morning today and in the afternoon tomorrow, otherwise it's not as effective as you want it to be. So I could go on about the different types of contraception if you want me to, but I just wanted to highlight that the choice you make is about how you live, your lifestyle, what you do. Do you play sport? Do you do all these other things that that need to be taken into consideration when me as a clinician I'm prescribing that pill for you or that contraceptive for you?
No, man. Her accomplishments are just tantalizing, honestly.
At a tantalizing.
They are tantalizing. I'm mesmerized. I'm like, how? Inspiring.
Inspiring.
I
but
like
I think
that.
it's really cool that you're a doctor, because it means all the questions we'll ask you are real life answers, right?
But what I want to know is that during her discovering that she wants to be a doctor, she wants to do this, she wants to do that, how did she really explore that part of her, that herself, having the crush, having all of that? So can you go use her, was she a boss lady even through that?
Was she a boss lady got the crushing?
Was she
That is so
was she
funny.
confident? Was she, I want to know more about that.
To the contrary, I was very shy.
She said I was very shy.
I was one of those who kind of looked down when a boy passes. So it's one of those things. I mean, if I remember one of my first crushes, must have been 13. So I had this crush on this boy called Sajid. He came from Kuwait. And just him coming from Kuwait was intriguing for me. And he had this dark hair that I thought was amazing. And I sat behind him in class. And I was thinking, one day, this guy will look at me. But then I was like, well, how will I react? Anyway, to cut the long story short, I found out he was just interested in my basketball skills. I was on the basketball team. And so was he. So that was only the things we discussed were around basketball. So that's how that first crush kind of ended.
That's very interesting. I think you're such a multi-layered individual, because I would have never guessed that you play
Same.
basketball. Also, your first crush being at 13 is crazy, because you strike me as the kind of person who went through school like books before boys, because boys bring babies. I'm not gonna have a crush. I'm not gonna look at anyone. So at 13, you're sitting there looking at boys. Dr. Lisa.
She's
That's the age when the
human.
hormones are raging. You're kind of trying to know your body, know
Yeah.
yourself. Yeah, but my next serious crush was when I was 16.
Hey, when you
Just
have
3
crushes
years.
every 3 years.
Just 3 years,
No,
we're
that's
like, I'm
nice.
ready.
Yeah, but that crush ended up to be my husband.
Ooh, love
it.
I love that.
Love
I love that.
it.
I'm taking that for myself, because I had a crush on a boy when I was 8, and now I'm dating that boy. So I hope that I can also sit and say, look, I'm a serious woman with a blazer, and I'm married to my 8-year-old crush, which is really cool. But I think it speaks to the human nature of having crushes, that even a person as accomplished as you, as serious and goal-driven as you, still goes through the process of having crushes. So it's nothing that's weird. It's nothing abnormal. It's something normal.
Yes, it's just before you are all that you become through studies and everything. You're just a girl, like everybody
just a
else.
girl.
So you go through the same things. Even today, I tell my husband, I'm just a girl. I like the bling. I like all of those
She
nice
said, I like
things.
but not the lashes.
No, not the lashes.
That's the plan.
That's where Dr. Lisa draws the line. Not the lashes. There's another girl, though, who likes things. Her name is Nthabi. And Nthabi is going through a journey of exploring her sexual health. I think by the time we get to episode 12, she definitely is taking a lot more charge of her sexual health journey. But I'd love for us to watch a couple of clips, then come back and unpack all that we see with Nthabi. Sure. Awesome. All right. Roll the clip, DJ.
So, ngiyabona. Sikanje step 1. And
Nthabi Singh?
yeah, ke sure ka eh.
Nthabi Singh? Batho, ga ke na letsatsi le lotlhe. Ga go nagalang ka lona. Guys, letsatsi la ka ke le lengwe fela. Maoto a ka ga o ka bona o rantsang a rorogile. E kgone ha e bereke le go bereka. Guys, mane. O itse ke eng ne? Ga ke batla re ka o sane o re okay ke ruti go etsalang, ne? Ha ke re la re batho pele. Ke tla ke tlo o thusa.
Okay.
Hey, one thing about my nest, batlo commend that. I think for me though, I really commend them being able to have that braveness to say, I'm going to go to the clinic and I'm going to take the first step into it. But I want to ask, are we allowed to bring friends to the clinic?
Yeah, absolutely. You're allowed to bring whomever you want, a trusted other, allowed to bring a friend, or you can go alone. So that's definitely allowed. I always recommend going with someone just so that they can advocate for your cause when they get to the clinic. Someone who's had that experience before will know how to navigate themselves around the clinic. Because sometimes you get to the gate, you don't even know where to turn, and someone who's had that experience can be able to guide you.
Or even you get to the clinic and meet the nurse and now they're shouting at you. Now you don't know what to do.
Oh yes, like in that one episode where she's like, aren't you Mom Dlamini's child?
Like, oh, Kanjani Prue, I'm just here to know more about my sexual reproductive health. So now why you get what I mean? Yeah. So how do you deal with that?
Yeah, actually, that's one of, believe it or not, one of public health issues that we try to address, attitudes of healthcare workers, particularly to young people. So what is happening now in South Africa, what the government has tried to push is youth-friendly services. So there are youth-friendly services across South Africa. Usually they are aligned with a community healthcare center, but you would find them. So I think that when you get such a reaction from a healthcare worker, of course they're a human being like everyone else, and they can be judgmental. And what you need to do for yourself is first understand that yes, there are judgmental people there, and how do I approach them? How do I conduct myself in front of someone who's judgmental? We understand people are usually judgmental when they've gone through things themselves.
Yeah.
Depends on their culture, their values, what they believe in. So it's not even about you, it's about them.
Yes.
And sometimes it's also okay to just tell yourself, I'll take a deep breath, because that sometimes centers you and it also controls your emotions. You know that judgmental people sometimes are condescending, they use a certain tone of language. So if you recognize that, you're better able to handle the situation, you're more in control and understanding that that's a judgmental person. Yeah. But I always say, be a bit empathetic. Give the healthcare worker grace. they also go through a whole lot of things, right? I recall in that episode, the nurse was saying, oh, it's hot, the aircon isn't working. But over and above all of that, they are overworked. They work long hours. They have to deal with difficult people.
Yeah.
So as much as I advocate for, sensitivity when dealing with young people and young people's issues, particularly when it comes to sexual reproductive health and rights, I think that as young people, we also have to put ourselves in the shoes of the healthcare worker and understand what their average day looks like.
And I'm glad you said the shoes of a healthcare worker, because I've been wondering some stuff, right? If I am just a girl, right? I'm Nthabi saying, and I'm going to the clinic, but let's say plot twist, I've got an STI, right? And I know this thing is not normal, it's itchy, there's a lot going on, I need to go to the clinic. That can be an extra layer of embarrassment when it comes to me seeking help. So in the shoes of a healthcare professional, because that's what you are, what goes through your mind when I walk through the door? Are you judging me? Are you saying, this girl, she's only 21, why is she coming here with the sex problems? No.
Knowing what I know and having gone through the experience of working for over 22 years, I'll just say, oh, not another one, would be my reaction.
So heartbreak.
It's a heartbreak in a way, because I'm like, where are we failing young people? Why are they not, feeling comfortable to come to me or to the health center and access these services? So I would look at that first before even thinking, oh, what is she doing here? No. I'll be quite naive to think that young people are not having sex. So I understand that. My job is to make sure they're protected, to make sure they have access to accurate information. And over and above that, we go beyond just the clinical or the medical part of it. You also understand the person.
Yes.
We talked about contraception. Are you able to negotiate safe sex and ask your partner to use condoms?
Are you in a healthy
Those are the things
relationship?
that we want to talk about as well. Is your relationship healthy? What's the consent thing in your relationship? All of those things come in that context of the health center, and most health professionals are quite equipped to handle those situations.
But thank you for clearing that up, because I think it really gives us a different view. Like when you're quiet and you're writing stuff down and you're thinking, you're not judging me, you're not side-eyeing me and saying this 21-year-old with an STI, but you're thinking, oh, I failed the girls, I failed the youth, I need to do better at my job.
I think so. That's the attitude I would take. And when I'm looking away writing down, it's because I'm required to write the notes down.
Oh, okay. Not because you're looking away so you can judge me.
No, I'm required.
Thank you for clearing that.
Yeah, because
Hey, now like how? Okay, sorry.
Sorry.
Now we apologize.
I'm
Now
so
like,
sorry.
hey, sorry.
But you spoke about contraceptive, and I know you've got lots of questions about contraceptives.
Yeah, I do. Actually, for a person that really doesn't know what type of contraceptives they want, how would I take that on? How would I go about it?
Yeah, that's quite simple, because you approach the healthcare worker, right? And they'll ask you a lot of questions.
Yeah.
And I always say, we spoke about, being shy or intimidated. Sometimes write down what you want to say so that you've got it clear. This is what I've come to get. Be a bit assertive, but not disrespectful in asking. So you go in there and say, I don't know what type of contraceptive I need to get. Can you assist me? Ask for clarity. And then you take it from there. As a healthcare provider, I'll tell you, these are your options. You have hormonal-based, you have non-hormonal-based. You have the tablet, you have long-acting, short-acting. Yeah. So I have to give you all of that information so that you understand what best suits you. So if I'm one who says, I don't really like hormonal-based contraception because I understand I'll gain weight or they make me nauseous or whatever, then we talk about that. And I said, well, there's these other options that I have for you. I can give you a copper-based IUD, or you can think about condoms. So that's the discussion you have. It's a negotiation almost, so to speak, until we get to the middle point where we're both happy. Yeah.
And they call you the minister of HIV on the streets. And I'm bringing this up because I know I spoke about this earlier, that when you use certain contraceptives, you're not necessarily protected from sexually... Yeah, what's sexual-related diseases?
Transmitted
diseases. Period. Sexually transmitted. See, I'm also learning, guys. I'm just a girl. I'm just a youth. Sexually transmitted diseases, right? And there was a tweet I saw the other day that was quite alarming, because I was like, I don't know if this is true or false, but also this person is saying it with so much confidence that I'm almost forced to believe them. And the tweet was saying that girls don't contract HIV unless they tear in their vagina during unprotected sex, because it's a blood transfusion thing. But as far as I'm concerned, in school we're taught if you exchange fluids, then you can, contract the disease. Can you please dispel the myth? How are sexually transmitted diseases contracted?
Well, it's in the definition.
That's what you would
first
think.
and foremost. But there are some risk factors associated with that. Let me take HIV because you mentioned that as something I'm quite passionate about, and indeed I am. Upon graduation, and I moved back home to Zambia. It was at the peak of HIV in the southern region. So, and at that time, ARVs were not so available. So that was the first thing that I had to encounter, and having lost family members myself, I became very passionate about it.
Yes.
Hence, now, as a public health specialist, I focus specifically on HIV. So yes, it is through transmission of bodily fluids, as we know. The HIV virus can pass through the barrier, the vaginal barrier, to get into your bloodstream and infect you. Why they say that when you have a tear, you're at higher risk is because, obviously, when you tear that barrier, you open the floodgates, so to speak, for the virus to swim through into your bloodstream. So that's why that's an added risk. But you can't say because I do not have a tear, I'm not at risk.
Yes.
The other key thing is to understand that other STIs are non-symptomatic. So you're asymptomatic, you don't have symptoms.
Sure.
And having that impacting your vaginal lining, it makes it vulnerable. So makes it easy for HIV to be transmitted. So that's why we always say, make sure when you're sexually active, you're testing for not only HIV, for all the other STIs as well, because they make you susceptible to acquiring HIV. Yeah.
Hey,
Nthabi saying, are you taking notes, ma'am?
I'm taking notes.
I hope you're taking notes.
I need my notebook.
She says, I need your notebook. Where's my JiK'iZiNTO
Where's
notebook?
my
Somebody
notebook?
bring the notebook. But it's I think when you speak about how ARVs weren't very available back then, it's actually wild to see how medicine has kind of evolved since that time until now, to a point where I heard that even with ARVs, if you take them, it comes to a point where you can be undetectable. So if a young person has contracted the HIV virus, what does healing or managing the disease look like now?
So, once you've been diagnosed with HIV, you go through certain blood tests. We want to understand what your CD4 count is, which is basically a level of your immune cells in your body. We want to understand your viral load, which is basically the amount of viral particles in your blood, because that guides us as to how then we can monitor you going forward to understand if the treatment is effective.
Yes.
So basically, once you've had those tests done, we check to see if you've got other infections, because with HIV comes other opportunistic infections that we want to treat. We do that. But once you've been diagnosed, we start treatment immediately if there's no other complication. And if you're on treatment, take your tablets every day, correctly, consistently, you would come to a stage where you come to an undetectable viral load. So that means that you're not able to transmit. So the government right now has got a very important program called U equals U, which means undetectable, means untransmissible. So when everyone understands that if I'm compliant and adhere to my treatment, I'm actually saving someone else's life because I'm not able to transmit.
Me, I have a question. So with ARVs being there, I feel like, because I've heard someone saying or they're not really afraid of HIV and AIDS. You get what I'm saying? Because there are ARVs that are given to people. The thing is, have you noticed if the stats have become higher or lower after the ARVs being accessible?
No, generally we've noticed that there's been a decrease in HIV infections, apart from in young women, adolescent girls and young women between the ages of 15 and 24. In this country, that's where we're seeing a lot of new HIV infections. So a lot of factors play with that, causing that as a risk factor for young women. So in a way, from a public health point of view, South Africa has done a lot to decrease new infections, but we're failing young women somewhere because they still keep contracting HIV.
Yes.
Yeah.
And would you say it's declined because it is declining, or it's declined because there are less people going to get tested?
No, it is declining because it is declining.
Okay, that's good.
We have a very good track record of HIV testing in South Africa. What we're lacking on is those that are who know their status and that they're positive are not actually getting onto treatment. So that's the main gap that we're trying to close at the moment.
I think what's important is that it's not the end of the road. If you've got an STI, if you've got HIV, there isn't a point where you're untreatable or you can't be helped in some way, shape, or form. So what I'm gathering from your conversation is that whether it's important to get tested because it's important to start treatment so that your quality of life can improve, but also so that you protect your sexual partners as well. Correct?
That's just it. In a nutshell, there's no point in suffering or going through severe illness when you know that I can be on ARVs and that will protect me and that will make my quality of life much better. Yeah.
So basic etiquette is just get tested for HIV if you are in a sexual relationship with someone, correct?
Correct, but it's not just getting tested for HIV that you're worried about. If you're in a relationship, there are other STIs that you want to test for as well. So I would just say regular health checks if you are in a relationship are what you want to do.
And when I go to the clinic for a regular health check, what does that process look like? Like what would happen from walking in the door to like what?
Yeah, so you come to the clinic, you encounter the receptionist first, usually.
Hi!
Both in public and private sectors, because that's the person who will keep your health records, right? So they will ask you for various types of information. Your ID number will be asked, whether you're on medical aid, your medical aid number, who's paying for your bills if it's in the private sector, where your address is, and so on. Why that's important is so that we can trace you if we need to, or we can be able to direct public health programs or initiatives your way if we feel that that's something you would benefit from. So that's why that information is requested.
So you're not going to call my mom and say, hey, she's got AIDS.
Absolutely not.
Okay, just checking.
And the other thing that's important to understand in a clinic setup is we have what we call shared confidentiality. So if the receptionist takes information from you and hands the file to the next person, that person already knows, because of their training, that this is shared confidentiality. I'm only having access to this because I need it to provide you the best service.
Okay.
So I know I won't talk about it after you've left. So that's something that you should be comfortable with as a young person. It's not going to spread around the communities. Well, at least that's what we hope it won't happen. Yeah. So once you've got all that information in, you go into what you call the treatment room, which is the first room that you go in, where a history is taken. What are you here to do? Want contraception? Okay. Do you have high blood pressure, diabetes, and all of that? That is also important for just your general well-being, and also to make sure that we're screening for diseases that we can easily detect while you're sitting there looking for contraception or looking for an HIV test. We're clearing that, making sure maybe you're not having other non-communicable diseases, and we'll be able to help you out with that. Once all of that is done, you'd sit through a pre-counseling session if you've come for an HIV test, and that is a process on its own.
Pre-counseling?
Yes, you have to get all the information around HIV, the benefits, the disadvantages, the advantages, all of that needs to be, you need to have that information to make an informed decision. And in all the processes from the reception all the way to the time you're walking out, it's your right to say, I don't want to move forward with this. I want to stop. And it's okay to stop and go and think about it again and then come back again. And when you're feeling better, or when you feel like you're able to better handle what information has been given to you. So once you've had those pre and post-test counseling, because now the post-test counseling is important. If you're HIV positive, that counseling session will focus on your options for treatment and care. If you're negative, it'll focus on your options of remaining negative, because that's what we want. So those options for someone who's HIV negative is, for instance, PrEP. I know my lifestyle, and perhaps PrEP will benefit me because I may engage in some risky behavior that I would like to protect myself from. So PrEP, being pre-exposure prophylaxis, as the name says, protects you before you are exposed to the HIV virus. So that's why PrEP is important. The other thing, especially once you've had unprotected sex, or there's been some sort of violent event or abuse, you also have post-exposure prophylaxis, which is after the exposure. You can be put on antiretroviral drugs that will protect you from contracting HIV.
Oh, that's cool.
Exactly. But this is time sensitive, so it depends on at what time post the event that you're taking the ARVs.
And what is that time frame?
It's 72 hours after the event.
Yeah, that's a lot.
That's a lot of information, because I was thinking to myself, what happens when you go to a clinic and then they give you every single thing, and now you end up feeling overwhelmed, you get what I mean? And I feel like with contraceptives, when they give you all the information, the side effects, everything, you end up not knowing what to choose.
Yeah, no, I agree with you. And that's why I always say break the visits up a bit.
Okay.
When you get there, you get a lot of information. I sometimes feel it's information overload because we're giving you information about all the different types of contraceptives, about all the different types of STIs and so on and so
It's a
forth.
lot,
It can
it's
be
scary.
overwhelming.
Very
So take it
scary.
step by step. But one thing that I always say is be assertive and ask for clarification. I am confused. I don't understand. Please explain this. Is it okay if I came back tomorrow when I've had time to digest this bit of information and then you can take it on? So all of that is part of your right as a patient, you know, in the health facility. So you can take it one step at a time. But what I think healthcare providers usually do, especially those that are quite experienced, they're good at honing in on your need. So they'll ask you questions that drive them in on what is your exact need, what is your exact concern, and maybe deal with that first.
And as an African girl, can I ask you, because I think for us, we aren't necessarily raised to be authoritative in our sexual reproductive health. It's not something that is encouraged. It's not something that's often discussed and can be seen as taboo. So when you're saying I need to walk into a clinic and be assertive about what I want, what I need, that's not something that I'm used to, because I'm always taught to be silent, shy away, and sit in the corner. So what advice would you give to someone in terms of mentally preparing yourself to be that dominant, assertive, this is for me, girl?
Yeah, sure. When I say assertive, I don't mean disrespectful.
Yes.
So that's one thing that, as an African girl, you know that, that will not be tolerated,
100%.
right? Like as any other girl, actually. So you go in there saying, this is the information I want. I mentioned earlier, prepare yourself. You can write notes. And when you go there, don't be distracted. Tell your story the way it is. Preparation is always helps. Respect helps. You also have to be self-aware. Don't walk into an environment that you know requires some level of calmness and want to be that hyped up person, right? So you have to be self-aware, look at what the situation is. How is everybody else behaving? You know, if everyone's sitting quietly in the reception area, it won't help you to be loud and demanding of certain services, because there is a line. Conform to what is usually what usually happens in health facilities. And I think that way you come out as assertive, when you just know your stuff, you're well prepared, and you're respectful in how you interact with the healthcare worker. Yeah.
That's good. I don't know if you've had an experience with contraceptives or anything of the sort, maybe the pill, or have you dabbled, or you are yet to dabble and see in season 2, Nthabi saying.
I'm still yet to see.
Yeah, yet to see and
I'm
dabble.
still yet to see, because I was given so much information that I had to make a decision for myself. What will work best for me?
And take it home, like Dr. Lisa said.
Yes.
Think about it.
I should
and
have brought my
meditate on it.
notebook.
She
Didn't
said,
know about that. Should have wrote down everything and say, I'm referring to question number 3.
yes.
And that's so
Yeah.
commendable. You have the right to come back another time when you're best, you
Yeah.
know, when you've digested the information, and take it from there. I think what's important is to take the first steps about your health, about your sexual reproductive health, so that you inform yourself, you understand the pros, the cons, what's out there, what are my options, and then, take your time and think about what you're going to choose at the end of it all.
And when you've chosen what you've thought about, after thinking about all of that stuff and you've chosen one. I was in a situation last year where I was put on, triphasal, to regulate my hormones and make sure that my periods are not 1,700 days, they're just 3 days. But what I found is, in taking that pill daily for 28 days, I felt sicker taking the pill than I did on my actual period. So when you're in a situation like that, where you can see, okay, the medicine I've been given isn't necessarily reacting well with your body, how do you then navigate that?
Sure, and you know that any kind of medication has some sort of side effect.
Yes.
Contraceptives as well. So you are the master of your body. You know your body well. So if you understand that this medication is not really doing what I thought it would do, I'm getting more sick, then you go back to the healthcare provider and say, I would like to be removed from this medication because it is making me feel this way.
1, 2, 3.
Yes, because when you describe how you're feeling, the side effects accurately, the healthcare provider will be better suited to help you. And they'll also understand that, okay, from my training, she looks like she's telling the truth, so let me just go with her here and try and assist her rather than push you back. So it's always important just to be honest and say what you are feeling. Otherwise, you might stay on that and have a poor quality of life for no reason.
Yes.
Exactly. So just mention the side effects you're having, and then you explore what else can I give you. Maybe it's because it's the hormonal base that's making you feel that way. There are other options that you can try that I can offer you.
Yeah. And in the South African context, where the public healthcare system is kind of choked up, there's very limited resources to go around for every single person. Sometimes you find yourself, unfortunately, in a situation where you'll go to a healthcare worker and address those things to say, the medication you gave me last time is making me feel like this, like this, like this. And you walk away almost feeling like you've been dismissed, like your needs weren't heard and you weren't necessarily given the solution that you were looking for. In a situation where I feel like at the clinic that's free and I'm getting free healthcare, that person is not listening to me or addressing my needs, how do I escalate that?
Yeah, patient rights charter in South Africa is there. You have the right to escalate if you feel that you're being mistreated, you're not being heard, or your needs are not being met. You can ask for a supervisor, you can go and give an anonymous feedback on how your experience was. I mean, there's a lot of avenues to raise those concerns. And I think it's important for young people to understand that it is well within your right. You are not doing anything wrong by complaining. You're not doing anything wrong by saying, I was treated badly. It's only through that feedback that the health system will correct itself.
Yeah.
There's a lot of health system related challenges at the moment, whether it's infrastructure, drug stockouts, whether it's attitudes of healthcare workers. All of that have to be taken into consideration to provide someone, a young person or any other person, the experience that you would want to have, the quality of care that you deserve. So I would recommend that you do speak out and you do escalate to a supervisor or someone who's of higher standing within that facility. Yeah.
And I think maybe this might be a dramatic question, but you're a lady with a blazer and an MBA, so I'm going to ask you the question. How does JiK'iZiNTO fill that gap and that need in the country?
For escalation, you mean? Or for just
in sexual health?
I think we do a great job of that. First of all, we try to influence behavior. So we have really, our approach is behavior science approaches informed. So if I can say it that way, we use social behavior change communication approaches and tactics.
Ma'am, that's a lot of English. Wow! Oh, I had to say, wait, pause.
Like, hey.
We use the
we
what?
Okay,
yeah. Please, explain it to me like I'm 10.
Okay, so social behavior change is just basically trying to use approaches and tactics that will influence some of the impact that your society and your community has on your ability to access services.
Okay.
So it looks at you as an individual, it looks at your family and the close network, and it looks at the community. But over and above that, it looks at the government and what their policies are to make sure that you get the services that you need.
Okay.
So we try to influence on all of those levels. So if you look at DiCHiPi, I'm influencing you at a personal level.
Yes.
I'm trying to get you to understand that there are these challenges, but this is how you can navigate yourself around them in order to access services.
That's good.
Whichever those services that you might need, right? So that's the way that we're looking at it. We look at other structural issues. You mentioned a scene where you go into the facility and there might be a crowded waiting room. The person is agitated. The aircon is not working. Yeah. We look at all of that from a public health perspective to try and address some of these structural issues that, because I find a waiting room is so full, I'm just put off. I go back home. How do I address that person who wants to go back home? I give them options. There's mobile clinics for men, especially who have poor health-seeking behavior and who feel coming
men.
I'm calling you out. Who feel like coming to the health center is a sign of weakness. The health system tries to work with you. We give you after hours. You can come in when the clinic is closed, but for these 2 hours.
Oh, wow.
We say they are men-friendly services just as much as they are youth-friendly services. So there's options that the health system is trying to correct to make sure that everyone accesses services that need to. So, yeah, that's how we're trying to address this and raise awareness around those issues through the work that we do, either with our community activations or through the media that we put out there, DiCHiPi. DiCHiPi UNFiLTERED.
The podcast.
Exactly.
Yeah, because we've had some really cool conversations. I mean, we had the Minister of Menstruation on here. The other week, we had another professional who kind of walked us through all the ups, downs, sideways of sexual health. And obviously, because President Cyril Ramaphosa is listening to this podcast, he's also going to be influenced, which is amazing. So thank you, Bab Cyril. Appreciate you. I think lastly, I just want to know if I'm a parent listening to this, or a parent who kind of wants to be involved, because I think one thing that we uncovered was that a lot of parents have uncertainties and they're kind of uncomfortable in terms of addressing the sexual health conversation with their children. If you had to advise parents on how to navigate that conversation, when Nthabi saying's father, we should have done this, didn't do it, how would you advise that parent?
I mean, because we implement the JiK'iZiNTO program, I would say Big Sis is a good source even for parents to go and get accurate information about some of these areas that they are curious about. But just generally, as a parent, I think you need to be approachable for your child to be able to bring up some of these topics, you know, and not feel judged or not feel like, oh my God, I will be killed. It is difficult. I have 2 teenage kids myself. My son's 19, my daughter is 17. And these are discussions that we have to talk about and navigate within the home. So just having that open mindset to say, what is the situation in South Africa? What do the statistics look like? There's teenage pregnancy. There's high levels of HIV, especially amongst young women. Gender-based violence is high. So what makes my kids special that they would not be confronted with these challenges? That's how I look at it. So therefore, it's my responsibility to give them as much information about these challenges and resources and options of how to protect themselves in order for them to live healthier lives. So that's how I look at this and approached it in my home. And I think that parents, as well as the community, should give young people a bit of grace. They were once young.
Themselves.
They knew what they went through themselves. So when you kind of look back on how you kind of confronted some of these issues, it gives you a bit of empathy in addressing these issues with your kids. If I knew then what I knew now, if I had Big Sis then, and if I had a show like DiCHiPi, I think I would have made better choices.
Yeah.
Yeah.
And it's not to be naive to the fact that your child will probably go through something like this.
Exactly.
Shying away from the conversation doesn't change the fact that at 13, Dr. Lisa was sitting behind a boy saying, love you, need you, turn around and look at me. But the number to Big Sis is 0600-747837. Save the number. It's an important number. You can WhatsApp Big Sis, whether you're a parent or a child. And I trust that Big Sis is not going to share your secrets because she's AI. She can't share your secrets. But before we get into the hot seat section with Dr. Lisa, I want us to look at a couple of clips and then we'll put in the hot seat. Let's go.
No side effects.
Mara, skabalibala, ne? Like I said, horenge ke contraceptive. Hai meaning hore itlo go thusa go tshwana le bo STI. Mara o gopole gore condom ke yone fela e leng goreng go thibela from STI. O tshwanetse gore o dirise condom. Okay? If una le partner A1, kana wa motlisa mo, re tlo mo testa, and then before le etsa whatever le gore le batla go etsa.
Ngiyacabanga ukuthi nami since ngila ngisebenza ngi-text nami yabo.
Okay, I can arrange that actually. All right? So, in the meantime, to go back and tell it to okay?
Ngimngani. And let's take a selfie to mark today. Okay. So, uzothi #copperingbay, ne?
Okay.
All right. 1, 2, 3, #coppering.
Feature Copper and Bay. It's our Lonana Gayo.
Okay.
All right, and just like that, it's time for the hot seat questions. Dr. Lisa, have you ever had an aspiration to be Miss Universe?
No.
Oh, I thought you were supposed to say yes, so that I can tell you you're going to make your dreams come true. Stick to the script in my brain. Don't you just hate it when you come up with a script for somebody, and they don't follow the script you gave them in your head?
Like,
boring. Okay,
I
fine.
wanted to be an air stewardess, though, if that counts.
Okay, fine. Think of this as your peanuts or what is it? Peanuts and nuts or raisins, something like that.
Yeah.
Think about that as an era that you're in right now, okay? But I'm the air hostess asking you questions. So we've got a hot seat era where you basically sit down and I ask you questions and you've got 60 seconds to answer those questions.
Okay.
So you must think very well. Use your MBA and all the degrees. Put them together and give us a concise English answer. But like English, I'm a grade 2. Not English, yeah, for America. Is that cool? Awesome. Nthabi saying, take us away.
So my lady, what happens now if I choose a contraceptive but I change my mind?
You're well within your rights to change your mind. You can choose a contraception today and change your mind tomorrow. I think that it's all about, number one, you making that decision about your health. And by going the contraceptive way, you're protecting yourself from unwanted pregnancy. If you use the condom, from STIs as well. So I would say change your mind as many times as you want to.
But now, what if it messed up my hormones?
We will work with that as healthcare providers. We will look at your hormonal profile and we will choose an alternative contraceptive that will work with you.
All right.
She's like, all right, thank you.
Okay.
It's just like job creation. You're going to give health workers work.
Yes, I love them.
My sister.
Love them.
My sister. Question number 2, Dr. Lisa. What if I run into someone in my family or in the community that knows me?
And you are at the
clinic seeking real health.
Sexual reproductive health services. Well, you can't control who you run into, right? It can be awkward. For me, the first question is, what are they doing here themselves? You know? So you kind of say, okay, so we're all here doing something. You don't need to acknowledge them if you don't want to. If you feel you have to, you can greet politely and move on. You don't need to spill everything about what's happening with you. Or you can keep it simple. Just say, I'm here for a routine checkup. And that's it. If they pick it up later when you've gone home within the community, for instance, oh, I saw you at the clinic today, you can just simply say my health visit is confidential and I don't wish to discuss it in this
Period.
End of.
Love it.
My body, my rules, my mouth. Silence.
So now
Love
what
that.
happens if you're not interested in sex?
That's also fine. There's a lot of reasons why you're not interested in sex. It could be because, you just mentally are not ready. It could be because physically you're not ready. That too plays a role. Or it could be because you don't have enough information about it. You don't know much about what happens when I have sex, what happens when I have the sex for the first time, what options do I have, and so on. So there's a lot of reasons why you would not want to have sex, and that's also okay.
And do you still go to the clinic?
Of course you do. There's a lot of other benefits that you can get from the clinic, apart from obviously sexual reproductive health services. Like I think I mentioned earlier, just that general checkup is great to screen for diseases that can be easily treated outside of the sexual reproductive health. So that's one of the benefits. You get information to prepare yourself for when you want to be sexually active. So they tell you what to expect. These are your contraceptive options. This is your prep that you might want to take, and all of the things we discussed can also be, you can get information about that. You can also get information about just relationships, how to navigate yourself in those relationships. The counselors are amazing at really walking through with a young person on how to negotiate safer sex practices, how to speak to their boyfriends. They give you some talking points. There's some role playing going on, making it easier for you to kind of get into that journey of a sexual relationship.
And I like the idea of role playing because I'm a girl who loves scripts. Like I want to know what the person's gonna say, but he has to stick to the script. Hey, I mustn't practice something at the clinic and then I get home and I try it and then he's like not sticking to the script. No, don't kill us. But for the final question, Dr. Lisa. Okay, 60 seconds. Africa is hanging in the balance and it's all dependent on your answer. How do I deal with judgment?
Judgment from anyone or judgment
Judgment
from
just in general. Stigmas, judgment around sexual health.
I think first and foremost, don't make it about you. Make it about the judgmental person. Because you are doing a commendable thing with accessing healthcare information, accessing contraceptives that will be important for your life now, for your education, for your future, your career. Think about all of that. So if you are well informed and convinced that the decisions I'm making are going to drive my future, are going to put me in a better trajectory to achieve my life goals, then that's fine. Then you don't have to look at judgment as if it is it's projected on you you look at judgment because it's projected on you by somebody else. It's not how you see yourself. So having that self-belief, number one, self-confidence, and understanding of this is where I want to go, makes it easier to address judgmental people.
Sounds like when you're embarking on a sexual journey, you must also do some work, some self-work.
Yes, because why then do you want to make sure that my sexual journey is safe and it is healthy? and ask yourself, what's my why? My why is because I want a healthy lifestyle. I want to achieve my goals, and I want to make sure that I achieve all the things that I've ever planned to achieve.
Yeah.
And that always helps. Yeah.
Yes, ma'am. We've heard it from the president herself, my personal president. Nthabi saying, I hope your character, well, Nthabi saying the character. I keep calling you Nthabi saying, but it's because in this moment, I told you, you are not Nkateko.
No,
you are Nthabi saying, and you're asking questions on behalf of Nthabi saying because there's a million people like you out there. But what do you think would be the key takeaways from today's conversation from your character?
The key takeaways, the magic words for me. Especially when it comes to judgment, it's not about you. So the next time someone judges you, shh.
You are the drama.
You are the drama.
You are the drama.
You'll be okay. I will pray for you.
I hope you find healing.
Thank you. And then you move on. But the other magic words for me was take care of yourself. It's not really about you wanting to please another person, wanting to be intimate with another person, but just it's about you. Take care of yourself and know more about yourself.
Yes, because if you don't take care of yourself, all your other dreams and aspirations and goals go out the window. But Dr. Lisa, thank you so much for taking time out of your busy schedule. I know President Barack Obama probably wants to meet with you to talk about the future socio-economic powers of the jargon of medicine important people.
Yeah, no,
right?
he's been buzzing.
He's been buzzing. That's what I heard. Good like
I said, I get a wait a minute.
Obama, we are busy here. We are busy.
Yeah.
But thank you so much.
Thank you. Thanks for having me. I've really enjoyed my time with you.
All right, and that's how we wrap up today's episodes. It's episode 12. Can you believe it? We've got one more to go. So make sure that you go all the way back to number 1 if you haven't caught up. Maybe you came here for Dr. Lisa because you wanted to see the star in action. But Superstar, I promise you, there's so much that you can learn and take. We've spoken about sexual health. We've spoken about mental health. We've even spoken about how you can get your money up. So make sure that you connect and join the JiK'iVERSE. Remember, the magic number to save is 0600 7478 37, and Big Sis will take your bag all the way to the top. But until next time from us, it's been a pleasure.